Good day everyone and welcome back to my YouTube channel. In today's episode of STIs, I'll be talking about syphilis. If you are new to my channel, I'm Mr. Manabring and I discuss everything health. Please don't forget to click the subscribe button and the notification bell to get notified on when next I post a new video. So if you've been following my channel, you notice I've been treating sexually transmitted diseases. I'll drop the link to the previous videos. Okay, so in today's video I'll be talking about syphilis. So what is syphilis? This is a bacterial infection that is caused by a bacteria called Treponema pallidum. So this can affect the skin, the genitals, and the mucous membrane as well. So what is the possible mode of transmission of syphilis? That's how can syphilis be transmitted from one person to another? This can be transmitted through sexual intercourse, can also be gotten through blood transfusion. That's why it's necessary to screen the blood before giving it out to whoever is in need of that. This can also be transmitted from mother to child while the baby is still in the womb. That is called vertical transmission, or during the course of delivery the baby can also get this. Okay, this can also be transmitted through indiscriminate handling of infected lesions. So this is peculiar to the healthcare practice. So you need to treat every lesion or every waste deposit as being infectious. So what are the possible signs and symptoms of syphilis? So before we move over to the possible signs and symptoms of syphilis, these signs and symptoms are classified into three stages. You have the primary, you have the secondary, and the latent. Okay, so the primary signs and symptoms comes to show like within 2 to 4 weeks of getting the infection. Then the secondary is 2 to 10 weeks after the primary. That if not being treated well. Then the latent can take years to actually manifest. So what are the signs and symptoms under the primary stages? There's presence of painless creeping ulcers, which is called chancre. So this can be seen in the genitals, around the genitals, the anal region, or even the lips. Okay, if this not treated well, can progress to the secondary stage. So moving over to the secondary syphilis, this begins about 2 to 10 weeks after the primary lesion was found, and these symptoms tend to become intense. So there is presence of flu-like symptoms like headache, fever, sore throat, and tiredness. So presence of non-itching rashes around the palm or the sole of the feet. Okay, weight loss can be found. Loss of hair, which is also called alopecia, is present at this stage. Then you can find some patches or flat overgrowth around the anal region as well. White patches on the tongue or the roof of the mouth can also be found. The last but not the least, you can notice some swellings around the neck or your armpit region. So in the latent syphilis, in most people the lesions tend to have disappeared, so they're like, oh, I think I'm well now. But no, it's getting to a more complicated problem like blindness, loss of coordination, paralysis, numbness, deafness, heart diseases, and so forth. So this is why you need to actually present to your healthcare provider at the early stage when you notice the creeping ulcer during the primary stage. So how can this be investigated, or how will you get to a diagnosis of, oh, I actually have syphilis? There are some tests to actually run. So you need to present to your healthcare provider, which will carry out some physical examinations for you. So what are they actually looking out for during those physical examinations? those ulcers, those sores and rashes, okay? After which they'll take a swab from the ulcers, which goes to the lab for investigation and reveals the causative agent. So the causative agent or bacteria being dictated will guide them on the diagnosis. So the next investigation is solely looking out for antibodies that are formed during syphilis infection. So they include Treponema pallidum particle agglutination assay. The next one is called direct fluorescence antibodies testing for T. pallidum. That's the causative agent of syphilis. So after this test is being done, then they'll make a diagnosis of if you actually have syphilis, and that will guide them on the treatment. For the treatment, there are some possible medications that your healthcare provider can use, such as ceftriaxone and benzathine penicillin, okay? So what is the prevention mode, or so how do you prevent contracting syphilis? One, you need to indulge yourself in protected sex, either anal or vaginal, and you need to also avoid oral sex and also sharing of sex toys. And also blood donor screening should be carried out before any blood transfusion is being done. So thank you for watching today's video. See you in my next video. Bye bye.